Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. Hello, my friends. I am recording this episode in the morning. This is the first time I've ever done this. I got up early and we are doing this episode before I go to work. So here we are. I am getting excited because this weekend is Fetch Nashville. Fetch is a conference that happens in different parts of the country, a veterinary conference that's educational and a lot of fun. My friend, Dr. Adam Chrisman, shout out. Hi, Adam, is just the main man at these conferences. He helps organize and put them on, and he is just a great friend to so many people, and he's so fun, and it's always exciting to see him. So yes, I am presenting a couple of lectures with my friend, Dr. Monica Tarantino, and she and I are presenting on behalf of the Senior and Geriatric Dog Society. So we are doing a couple lectures on Saturday for veterinarians and veterinary technicians about how to care for senior dogs and some practical tips on treating senior dogs for common issues and senior dog care programs in your clinic. So I always love speaking about senior dogs and being at Fetch. And it's in Nashville every year now for one of its stops. So that is what I'm doing this weekend. So just getting ready for that, which is why I am here in the morning, because I got to go to work and then I got to get ready for the conference. There's just a lot going on. I do have a hot take today, and this hot take, I thought about the best way to say this. So here's what I'm going to say. Not all veterinary opinions are created equally. And why I'm saying this is because there are, and this is the same for any type of medicine, human medicine, veterinary medicine. There are a lot of opinions in veterinary medicine, and there are a lot of practitioners out in the world practicing veterinary medicine, all different ages, all different educational backgrounds, all different philosophies on things. And most of them are not necessarily wrong, but we all have a little bit different opinion on a lot of things. There are no sort of regulatory things to say veterinarians have to follow updated guidelines on XYZ. Each state has a veterinary board, and each state requires different types of continuing education, but there's only so much that those types of rules can force people to educate themselves and know what current medicine, what current recommendations are. And the reason I'm talking about this is because I am in a group on Facebook where there are human and veterinary doctors in that group, and we give each other advice. It's a great group. But there was a discussion about leptospirosis vaccination in that group. And there's a veterinarian who is a retired veterinary specialist who commented that she doesn't vaccinate her dogs for leptospirosis because they have a low risk of it. And when I saw that, I knew there's a vet telling her that her dogs don't need the lepto vaccine because this is an antiquated sort of thought that the lepto vaccine should be reserved for dogs who are in water, like hunting in water or drinking standing water, and that the risk of lepto for indoor only little dogs is low. And that just simply is not true anymore. And leptospirosis has been made a core vaccine because it is in all parts of the U.S. now, in a lot of the world now, and it is a risk to all dogs to a certain degree. Do some dogs have more risk? Sure. Have I diagnosed little indoor dogs in downtown Nashville with leptospirosis? Yes. So, this retired specialty veterinarian who didn't work in GP, I don't think, for the bulk of her career. She's just sort of blindly trusting this vet who she said she's had for a long, long time. And it just sort of made me think about, wow, if a veterinarian is being convinced of this information that's just simply wrong, then people who aren't veterinarians are definitely being told these things and going with it because, of course, they trust their vet. And I'm not saying this to say, oh, you shouldn't trust your vet unless they agree with what Dr. Molly says. But there are some very large opinions that are a consensus from lots and lots of veterinarians and lots of specialists and lots of research. And so if you trust those types of pieces of information based on science and facts and research, then those are the opinions that probably should be followed. And so it's never wrong to get a second opinion, or if you hear something from another trusted source that differs from what your veterinarian is telling you, I just would encourage you to find out why those things are different. And the reason it's important is because I have diagnosed little indoor dogs with leptospirosis. They have died, a lot of them, or they've had severe, very expensive to treat liver failure. And I've had to have really uncomfortable conversations with those dog owners about how leptospirosis is a preventable bacterial infection. It's prevented by a vaccine. And I've definitely had owners say, well, I was never offered that vaccine. And so that happens. And it's just an important thing to remember. And I literally was reading it yesterday from the mouth of another veterinarian. So I thought, this is important to say. And yes, we haven't gotten into nitty gritty of vaccinations, but I'll say this now. Leptospirosis is an annual vaccine. It's a bacteria. Lepto is a bacteria. And so it's not a viral vaccine. So it works a little bit differently than some of our other vaccines. And so that is why it's recommended every year. And it's also why checking titers for lepto is not very reliable. So there's a whole discussion right now on checking titer levels to determine if a dog or a cat needs a booster vaccine. And there is some relevancy and legitimacy to that. But when we're talking about something like lepto, there's not an established titer level that's going to really tell us that, because once they've been exposed to that, either with a vaccine or infection, we're going to see antibodies to it. So that may not make complete sense about the titers and all that. We'll get more into that. But really the hot take is not every opinion is always absolutely correct. And it's okay to get a second opinion or ask more questions if something doesn't make sense or goes against what other trusted sources are saying. Okay. That's all I'm going to say about that. We're going to do another disease today, and I'm excited about this one. I've had a lot of questions about this. This is going to be some more hormone talk for dogs and cats. So we have a lot to talk about with cats today. So I know my cat people will be glad for that. So we have talked on this show about Addison's disease and Cushing's disease, which are adrenal gland disorders. So today we're going to talk about thyroid gland disorders. And these are two things I really enjoy treating in practice. One of them is a very rewarding disease to treat, and so we're going to get right into it. So if you don't know much about the thyroid gland, that's okay. I'm going to tell you what it is and what it does and what can go wrong with it. So the thyroid gland is a small gland. It's located in the neck of humans and dogs and cats, and it's kind of this butterfly-shaped, sort of thin piece of tissue. It has two lobes, kind of looks like a butterfly, like I said, and it sort of lays over the trachea. So they have a lobe on each side of the trachea. And it's near the throat latch there, and the two lobes are connected by this little connector. What's it called again? Isthmus. And so this is a gland that is regulated by the pituitary gland in the brain. We talked about this with the adrenal gland. So most of our endocrine diseases work this way. So the pituitary gland secretes thyroid stimulating hormone. Okay. And that is a hormone that tells the thyroid gland to make the thyroid hormone that's going to go through the bloodstream in the body and regulate different systems. And T4 thyroxine is the main thyroid hormone that gets released by the thyroid gland, and that goes into the bloodstream. And then T4 is turned into T3, and that's what's actually used by tissues But T4 is what we're going to focus on, because this is one of the main hormone that we measure and we think about, we talk about with thyroid disease. So what you need to remember if you really want to understand how this works is that the pituitary gland, which is part of the brain, makes TSH. TSH tells the thyroid gland to make T4. And so our T4 levels are going to fluctuate in the bloodstream for different reasons. And T4 thyroid hormones and T3, they regulate a lot of different systems in the body, just like all of our endocrine systems. It's very important. So metabolism is a big part of thyroid hormone, regulates our metabolism, dogs and cats' metabolism. So if there's too much thyroid hormone, it can speed up metabolism. If there's not enough thyroid hormone, it can slow it down. Thyroid hormone regulates heart rate and cardiac output. So how fast the heart is pumping and how well it's pumping blood out of it. Body temperature, that can affect neurologic and brain development. Thyroid hormone has a lot to do with skin quality, coat quality. Reproductive hormones, there's a connection between thyroid hormone and reproductive hormones, and lipid and cholesterol metabolism. So those are the main things that thyroid hormone does. And we see two main problems in thyroid hormone in dogs and cats, and they're opposite. So dogs do one thing, cats do the other thing. And so we'll start with dogs, and then we're going to talk about cats. So most dogs with thyroid disease are going to have what we call hypothyroidism. And this is a condition where dogs do not have enough circulating thyroid hormone in their system. And so all of those systems and processes that I told you thyroid hormone regulates slow down. So we think about hypothyroid dogs as low and slow. So they're cold. So these dogs, we say they can be heat seeking. So suddenly you may have a dog who just really wants to curl under a blanket. It's going to your heat register. That's where they want to be. They just seem a little more sedentary, not as active as they used to be. They may seem a little depressed and lethargic. Because metabolism is affected by thyroid hormone, they can gain weight. So a lot of hypothyroid dogs will gain weight, and there's really not a good explanation for that. Maybe that they're just not as active, but they're not really eating more calories than they used to. They don't seem more hungry, but they're gaining weight, or we're not able to get them to lose weight. A lot of hypothyroid dogs will have skin issues, so they can have alopecia, so they can lose hair. A lot of times we'll see thinning coat along their back, their top line. The top of their tail is a place we'll see hair loss. It can be anywhere. Another thing we see commonly in dogs with hypothyroidism is hyperpigmentation of their skin. So their skin will turn dark over time as well. This all has to do with what a normal level of thyroid hormone does with skin turnover and hair growth in the body. And what am I forgetting? One of my favorite signs of thyroid disease is these dogs will have what we call a tragic face. So if you follow me, a few months ago, I posted about a case, a golden retriever. His name was Wally. His name is Wally. Wally is alive and well. He's with us. And he was a younger golden retriever, but he just had a really sad, droopy face. And he just had this classic tragic look. They just look sad. And turns out he did have hypothyroidism. And so his face is a lot perkier now. A lot of these dogs will have chronic skin issues, ear infections sometimes. If they are some type of breeding dog, they can have infertility. We don't really run into that a lot. And in rare cases with severe hypothyroidism, we can see neurologic signs. And so you can see they can get wobbly. In worst case scenario, they can have seizures, weakness. Neurologic changes are very rare. So it's something that vets maybe keep in the back of our brain when we're talking about a neurologic dog. But most of the time, that kind of mental dullness, lethargy, weight gain, hair loss, hyperpigmentation, skin issues, that's usually the most common thing we're going to see with hypothyroidism. Okay, who gets hypothyroid? So middle-aged dogs are our most common culprits. Female dogs are a little bit overrepresented versus male dogs, but it's very much can affect both genders. So 4 to 10 years old is kind of when we see this. It can be younger, it can be older. There are 2 basic types of hypothyroidism. So how do they get it? So there is a form of hypothyroidism that's congenital. So there are some dogs who are born without enough thyroid tissue. That's pretty rare, and it causes pretty significant problems early on while they're developing. And so you and your vet are going to know that if that happens with a puppy. And so what's most common is what we call acquired hypothyroidism. And it's usually primary. So the thyroid gland is destroyed. And there is one form of that we call idiopathic atrophy. We don't really know why it happens, but the thyroid gland just basically gets smaller for no obvious reason. And then there's another thought we have about why the thyroid gland is destroyed, and that's called lymphocytic thyroiditis. And so it's thought to be an immune-mediated process where the immune system is actually destroying part of the thyroid gland. So however it happens, most commonly this happens over time as dogs age and their thyroid gland just gets smaller, less active, and it's just simply producing less thyroid hormone. Common breeds that have hypothyroidism, it can happen in any breed, but golden retrievers, the poster children, golden retrievers, Dobermans, Cocker Spaniels, Dachshunds, Boxers, Great Danes, Labs, a lot of bigger dogs, and then Dachshunds. But any dog can have hypothyroidism. So I'm going to take just a moment for a little soapbox, and I've seen a couple of vet creators talk about this lately, which is great. Hypothyroidism, we really want to diagnose hypothyroidism, okay? We pet owners and we veterinarians sometimes get a little bit too eager to say, oh, it must be hypothyroid. That's why this dog is fat. There's a lot of situations where, I'll talk to a dog owner and they're like, oh, I think my dog's hypothyroid. That's why they're gaining weight. And I'm just convinced that's what it is, which is fine and fair. And we run the blood work and usually that thyroid is normal. So in overweight dogs, if the only symptom in that dog is that they're overweight, a lot of times, especially if cost is a concern, we're going to try to lose weight first. And if we're unsuccessful and we truly stick to a plan of decreased calories and we're not losing weight, then sure, I think it's very warranted to spend the money checking our thyroid hormones. But hypothyroid dogs really shouldn't be able to lose much weight with a restricted caloric diet. And so that is one thing to be sure of, that we're not just overweight because we're eating too much. Another kind of little nuance about thyroid is when we suspect a dog may have hypothyroidism. For me, at our practice, we have a great wellness panel that we can send to a lab, and it includes full blood work, and then it includes a thyroid panel. And that panel has a total T4 and then another level that's called a free T4. And this is a little bit complicated physiology, but there are 2 forms of T4, that thyroid hormone that can be measured in the bloodstream. One of them is total T4, and that level can be affected by other factors that are going on the blood work in the blood. And so there's a different test called a free T4. One is by equilibrium dialysis, and this is just a more accurate reading of the truly available T4 levels in the blood of a dog. And so those 2 levels, especially a free T4, give us a better idea of how much thyroid hormone we have to work with. And there is a condition that we call euthyroid sick syndrome. And so if a dog has another type of illness or issue, that can make their total T4 look low, but the free T4 is actually normal. And so there is some overdiagnosis of hypothyroidism if we're just relying on the total T4 level, because like I said, it can be falsely low for another problem. And so when we suspect hypothyroidism in an ideal world, what we're going to do is we're going to maybe run a total T4 first to screen for hypothyroidism. So if a total T4 level is normal, it's not low, it's not very low normal, then that dog doesn't have hypothyroidism. If that total T4 is low and we have clinical signs of hypothyroidism, then it's very warranted to then run a full screening panel for hypothyroidism. And that panel can include a free T4, like I was just telling you about, and then we can measure the TSH levels in a dog's system. So remember, TSH is that hormone that the pituitary gland secretes that stimulates the thyroid gland. And if we have hypothyroidism, what will happen is the pituitary gland recognizes that there's not enough total T4 in the system. And so it ramps up that TSH to try to help the thyroid gland along. Come on now, produce more thyroid hormone. And so that TSH level will be elevated in a hypothyroid dog. So if the T4 levels are truly low, the pituitary gland is going to try to compensate for that, and that's going to make the TSH levels go high. So that's how we get to a more definitive diagnosis of hypothyroidism. So you just need to remember low T4, high TSH. That typically means hypothyroidism. So that's a pretty straightforward diagnosis, and that's literally what we do. And if we diagnose hypothyroidism, then when I talk to owners about that, I say, hey, we were right. Your dog has low thyroid function, hypothyroidism. The good news is we can treat this. It's very affordable to treat. It's pretty straightforward and simple. And we are going to go on medication for life. This is an important thing to remember. Once we start thyroid supplementation, we're never going to graduate from treating a dog with hypothyroidism. That thyroid is never going to grow back because of the medications. We're just simply replacing the hormone. And so once we start thyroid supplementation in a dog, they're going to need to be on that forever and ever. Amen. As long as they truly have hypothyroidism. So once we start that medication, so we typically put our patients on levothyroxine. So it's just a thyroid hormone supplementation replacement. It's synthetic T4 basically. We dose that by weight, so different doses for different size dogs. And for a long, long time, we always treated hypothyroid dogs with thyroid replacement twice a day, so 12 hours apart. BID, we say. But there's been some newer research in the last few years that shows that a lot of hypothyroid dogs actually do just as well on once-a-day supplementation. So, for example, a really big dog might take 0.8 milligrams of levothyroxine twice a day. But I personally, if a dog is not super clinical, they have some signs, their thyroid levels are low, but they're not horribly low. A lot of times I'll try them on once a day first. So we'll do that medication, whatever dose they need once a day. But depending on the case, sometimes we start it twice a day. Either way, your vet's going to prescribe thyroid supplementation. So for me personally, when I start my dog patients on thyroid supplementation, I'm going to recheck that T4 level in about a month. So I will typically send them home with about 45 days worth of medication. That gives us a little grace period. If we can't get there right at a month, we're going to recheck the total T4 at 30 days. And depending on that level, we may adjust the dose or the timing. So if it's not as high as I want it to be and we're on once a day dosing, we'll go to twice a day dosing. If we're on twice a day dosing and it's higher than I want it to be, we may cut down to once a day, or we might actually cut down our dose. So yeah, that's kind of how thyroid supplementation goes. We recheck at least once at the beginning. Sometimes we get right to the sweet spot of right where we want that hormone to be. There's a sort of a range. We want it to sort of be on the high end of that range. And then once I arrive at the thyroid level, hormone level I want my patient to be at, and we have clinical response, then I'm typically going to recheck that thyroid hormone about every 6 months. So long-term maintenance, I like to check thyroid hormone levels every 6 months. And some vets may do that less often, but at least once a year. It's very normal for your vet to require that we check that thyroid hormone level at least once a year in order for you to keep getting medications. Sometimes people protest that, but we promise we do that for the best of your pet and you. So thyroid hormone monitoring is not extremely expensive. The medication is not very expensive. So this is like I said, one of my favorite diseases to treat because it's very rewarding. We usually get pretty quick response clinically to that treatment. So I love to see a hypothyroid dog come in at their 1 month recheck and their owners are like, oh my goodness, it's a different dog. We have so much energy. Look, our hair's growing back. So it can be very, very rewarding. Another thing, just a little nuance about thyroid checking is that when we recheck that total T4 level, a lot of times your vet's going to have you time that and come in for that blood draw about 4 to 6 hours after we give that morning dose of the medication. So that's just another random thing. I will tell people if we're starting on once a day thyroid supplementation, I have owners give that in the morning so that it makes it easier to time that when we come for recheck blood draws. There is some also newer research that says the timing of that blood check is not as important as we thought, but I try to just line it up in that 4 to 6 hour window since that morning pill, just because that's technically more ideal. So that is literally it. Hypothyroidism in dogs. Get them on supplementation. They're going to do better. And you're going to just check their blood work a couple times a year and keep them on the meds forever and ever and ever and amen. Please don't stop giving thyroid medication. Okay, that's dogs. Let's talk about cats. Celsius break. All right, cats do the opposite of dogs. Cats typically have hyperthyroidism. So this is going to be an overproduction of thyroid hormone. In cats, most cats with hyperthyroidism have benign overgrowth of thyroid tissue. Okay. So it's like a benign tumor on the thyroid gland. There is a small percentage of these cats where that growth of the thyroid gland is cancerous. There is a way to test for that. It's not the cheapest procedure. So a lot of cat owners don't go through with that testing, and we just treat it as if it's benign because, again, that's going to be 98% of these cases. So the cause of hyperthyroidism in cats, we're not exactly sure what that cause is, but we're going to see sort of the opposite of what we see in hypothyroid dogs. So hyperthyroid cats will lose weight, but they seem starving. So classic exam room conversation I have with hyperthyroid cat people is their cat is just badgering them to eat. They're super vocal. They're just meowing for food constantly, but they just keep losing weight. They're eating, but still losing weight. They can have some behavior changes. So I'll have clients say their cat seems more aggressive or they're just more vocal. They're not sleeping. They seem hyperactive. They can have GI symptoms, so vomiting, diarrhea. One thing that's kind of random I will see, and it is a pattern, hyperthyroid cats, people so often will tell me they're pooping outside the litter box. I don't know, other vets weigh in, tell me if you see that, but it's just a common thing I hear from hyperthyroid cat owners. These cats will have high heart rates and they can develop heart murmurs. They can have high blood pressure because of hyperthyroidism, and some of these cats will have increased thirst and urination. So those are kind of the more common symptoms that we'll see, but the hallmark is more vocal, eating, losing weight, and then just some changes in behavior. They can have poor coat quality, and their fur can get kind of greasy as well. So in cats, when we suspect hyperthyroidism, we will test their T4 levels. In cats, TSH is not as important. So their total T4 and ideally a free T4 can be run. If those are elevated, we pretty much know, especially if they have clinical signs, this cat has hyperthyroidism. So when we diagnose a cat with hyperthyroid disease, it's a little more complicated than dogs with hypothyroid as far as how do we want to treat it. And so the goal of treatment is to decrease either thyroid hormone levels that are in the system or to actually shrink or remove that overactive thyroid tissue. And so when we talk to clients about how do we want to treat this, there's a couple big options. So the one option I want to spend a little time talking about is what we call radioactive iodine therapy. So I-131 is what we call this. And this is what's considered the gold standard of treatment for hyperthyroidism in cats. It's what is curative the most. It's the most successful treatment. It can seem a little intimidating to owners when we first talk about it because we're talking about radioactive iodine. And it does require that cat be in a hospital setting for a few days. And it does cost a significant amount of money in the long run, though, when we think about other ways to treat it, probably all comes out in the wash. And so if owners can make that initial investment, this really is an ideal treatment for hyperthyroid disease. So what happens is if you have a cat go through I-131 treatment, they're going to go to a hospital type setting. They're going to get an injection of radioactive iodine, and that radioactive iodine is going to be taken up by that overactive thyroid tissue, and the iodine will destroy it. And so it's very, very cool. And they're going to hospitalize your cat for 3 to 5 days, depending on where you are and what the hospital's policy is for radiation safety. No one's really going to touch your cat for those days. They will be cared for. They will be fed and have water and all of that and monitored. They really don't need anesthesia for this. They may get sedated for this, but it's really not as big of a deal as it sounds or maybe feels. And then when they go home, you're just going to handle them minimally for a couple of weeks. But I think it's like 95% of these cats are cured with one dose of I-131. So if you are able to afford that procedure and you have a cat with hyperthyroidism, this is a really, really great option. You want to make sure you have a clinic in your area that offers that service, but it's getting a lot more common in a lot of areas. So that's option number one. Option number two is an interesting option. There are prescription foods, cat foods, that are iodine restricted. So I typically reserve this option for single cat households. And the reason is if you have other cats in your home who are not hyperthyroid, you do not want them, they can eat this food, but they do have to have some other source of food that does have iodine in it. And so that can get very tricky because your hyperthyroid cat cannot eat any other food. And so this is a good option, especially if we can't afford I-131 or we don't want to do that. And we have just one cat in the home. So if the cat only eats that food, the iodine will be severely limited, and that will cause a decrease in thyroid hormone. This is all they can eat. They can't have treats. They can't have table food, just this prescription food. It can be curative. The actual thyroid tissue can still be enlarged. When we examine a cat with hyperthyroid disease, we can sometimes feel their actual thyroid tissue enlarged. We call that a thyroid slip when we feel their neck. So they can still have that enlarged thyroid gland, but it's just not going to be producing the thyroid hormone like it was. So food is another option. And then the third option is a medication. It's called Methimazole. Methimazole inhibits thyroid hormone synthesis. So Methimazole can be given in a couple of ways. We all realize it's difficult to pill cats on a regular basis, a lot of cats. So there's a pill form, and you can give a transdermal form of Methimazole. So it's like a gel that they absorb through their skin, usually on their ear. Transdermal medications in cats never are absorbed as well as oral medications, but they're there because we know a lot of cats do not tolerate taking oral medication. Sometimes this is used just for the short term. So veterinarians will put cats on this medication while they're waiting for I-131 treatment. But then cats that don't have the option to have I-131 or cats that can't go on the prescription food may go on Methimazole long term. It's a little bit trickier of a treatment to use because, again, we have to do a lot of blood monitoring, like with hypothyroidism, and we can have complications just because cats don't want to take it. The dosing, we change doses in hyperthyroid cats with their Methimazole more often. It's just harder to treat with the medication. Hypothyroid dogs, very simple with that supplementation, but inhibiting that thyroid function is a little bit more difficult with medications. Methimazole can have side effects, so vomiting, facial itching, pruritus, can cause some liver issues and blood cell issues. So we're going to do regular blood work. We're going to make sure all those other blood levels are doing okay while we're on the Methimazole. And again, if this is how we're treating cats, then we're going to do this long term forever. They're not going to ever graduate from taking Methimazole unless they eventually go on I-131 treatment. So again, Methimazole I-131, prescription food. Those are our 3 options. Something interesting that can happen in cats when we treat their hyperthyroidism is that they can develop elevated kidney values after we slow down their thyroid. And that's because this is very interesting. It's a little complicated, so bear with me, but I find it fascinating. It's because GFR, glomerular filtration rate, that's the rate at which the kidney is filtering things, right? So when thyroid levels are high, so when cats have hyperthyroidism, that elevates their GFR. And so we know that kidney disease is common in cats. And so cats that have hyperthyroidism and also underlying kidney disease, when their thyroid levels are high, their GFR is elevated. And so that actually can kind of help their kidneys move along. And so their kidney values look normal. Their kidney function looks more normal. But then once we slow down that thyroid function or we remove all that thyroid tissue, their GFR actually will slow down, and then we will unmask kidney disease. So it's pretty common, and this is a very frustrating thing that we'll run into. Veterinarians will treat a cat with hyperthyroidism with methimazole or I-131, and then all of a sudden they are azotemic, their kidney values are high. So it's just part of it. It's something that happens. We address it and we just figure it out. Once that happens, it makes it a little bit trickier, but it's not uncommon. So methimazole is not causing kidney disease. I-131 is not causing kidney disease. We're just unmasking what was underlying, and it was being changed by the high thyroid function. I have had clients ask me, well, should we just leave their thyroid high so that they don't have kidney disease? And that's a very fair question. The problem is high thyroid hormones, hyperthyroidism, can cause even more serious issues than kidney disease, like really high blood pressure, heart issues, heart disease, and it can cause fatal issues with blood pressure and heart. And so we have to sort of balance the risk and benefit. And so for me personally, I'm going to treat the hyperthyroidism and then we'll manage the kidney disease from there. And the other thing to remember about that is eventually the kidney disease is going to be a problem even in hyperthyroid cats. That GFR increase and that sort of masking of it is definitely going to be temporary. Another thing we may monitor in these hyperthyroid cats is their blood pressure. So we're definitely going to get it when we first suspect it or diagnose it. And then we just want to make sure that it goes back down to normal if it's high when we diagnose hyperthyroidism. So hyperthyroid cats that have I-131 treatment, one interesting thing that can happen is they can become hypothyroid secondary to that treatment when we destroy all that thyroid tissue, especially if most of their thyroid was the abnormal tissue. And so that's just another interesting thing that can happen. So cats can become hypothyroid from that treatment. We treat them the same way as dogs with hypothyroidism. They get a little bit of thyroid supplementation and they do great. Definitely still worth treating their hyperthyroidism with the I-131. And then I didn't mention, but in dogs with hypothyroidism, well, not with hypothyroidism, but there is a small portion of dogs who can have hyperthyroidism. I have diagnosed this before, and usually it's because they have some type of cancer growing on their thyroid gland. So hyperthyroid dogs will have a lot of the same symptoms as hyperthyroid cats. An interesting symptom I've seen in the 3 dog cases I've diagnosed with hyperthyroid disease because of cancer in their thyroid gland is that they cough. And I think it's just because that enlarged tissue is just right here where their larynx and their throat is. And so it can irritate that area or just be somewhat obstructive and make them cough. So those are those 2 kind of exceptions. Dogs are hypothyroid, but they can have hyperthyroidism. Cats typically are hyperthyroid, but the treatment can make them hypothyroid. I think that's all I have to say about thyroid disease in dogs and cats. I hope this is helpful. I do think it's so important for y'all to understand what's happening in your pet when they're sick. And it's hard for your vet to take the time to explain all of this way. They just don't have time for that. So that's what this is for. You should always chat with your vet about what needs to happen, what the best next course of action is. But if your cat or your dog have any of those symptoms, it's always fair. Check in with your vet, see if they think that warrants some testing for thyroid disease. I am going to do some follow-up questions about thyroid disease in the next episode. So DM me your questions if you have follow-ups about this topic. You can send questions also via the link in the bio of the Dr. Molly Says Pod Instagram page. Make sure you're following me at Dr. Molly Says, the podcast Dr. Molly Says Pod, and we are on YouTube, so you can watch our episodes. Make sure you rate us on your podcast platforms, download our episodes. We're here every week, and I'm just excited to chat with you again very soon. We've got some really cool interviews coming up. I know you've been having to just listen to me for a few weeks, but I've got some really great guests that are getting recorded this weekend while I'm at Fetch. So I will see you next week. This has been another great episode of the Dr. Molly Says podcast.